So you may have wondered why I started this way. And actually, this is 1978, 40 years ago to the day. I was a medical intern in Beirut during the war. And we had 100 days of non-stop bombing around the hospital where I was in Beirut, and the whole neighborhood, obviously. And I think I made you hear a sample. What you heard is even less than what we were living 24 hours a day. A few hours of stopping sometime, but the nights were always full of bombing. I used to play guitar with the friends for fun, so I had my guitar with me. We had managed to have a shelter in the basement of the hospital, and we had the patients, the nurses, the doctors. We were all there together, living at the same time in a small place. And I used to play guitar. During the bombing you heard, I wanted you to hear it today. And I would play guitar while the bombing were phoning on us. I was probably very crazy, but it was good to be crazy at that time. That was the way you could survive emotionally. And everybody started to sing and dance during the bombing. It was hilarious. And I forgot these. A year or two ago, I realized that maybe it was some form of music therapy without me knowing about it. So I started to talk about it, and today I said, I'm going to share it with you and play Scarborough Fair, which Bernardo suggested I do. Thank you, Bernardo, by the way. You were great. But I didn't play Scarborough Fair, because obviously, if you want to play music during the bombing, you have to play rock and roll, the Beatles, La Bamba, this kind of stuff. Otherwise, you can't match. And also, I realized, I learned from all my wonderful friends from music therapy that you have to raise the level of the intensity to the level of the emotions. And I did it without even knowing about it. This just impresses me a lot. So that was my introduction between the war, the music therapy, and medicine. So I work at Roosevelt Hospital, which is now called Mount Sinai West. And I'm going to tell you my story and share with you some patient stories to walk you through the cancer world. So, Jerry was a patient of mine, 39-year-old. She was dying of breast cancer at the hospital, imminently. We expect her to die 4 or 5 days, anytime. And she was like the star patient for all of us, and she was calling the team who took care of her, my dream team, every day. She loved her doctors, her daughter, all love her. So one evening, I'm leaving to go home. So I said, Jerry, you want me to do anything for you before I leave? She said, I am dreaming of a lasagna plate. She was an Italian-American. And I left her room thinking it was some joke. And then I said to myself, what is he asking for, a lasagna plate? So there was a great restaurant next to the hospital. I called him up, an Italian restaurant. Said, do you have lasagna on your menu tonight? Said, sure. So I ordered one for her. The next morning I came, she was smiling over here. And she died 4 days later, and she told the story every day about the lasagna. And I said to myself, I paid $25. I made a phone call, and I helped this woman die happy. How simple. And I started to dream. We can make so many things with nothing. Little things. This is 20 years ago. And I started to dream about doing things like that, music, because I love music, art. So the idea started to grow. I was dreaming of this one day. And then come Helen. Helen was the wife of my friend, Fuad, from high school. Right here, that's Fuad. Helen, their 2 kids. And Helen was diagnosed with breast cancer at age 33, a very aggressive breast cancer. And I knew her chance to survive from this was small. She went through 4 years of difficult treatment, had some good moments, some difficult moments. Eventually, she died at age 36 and a half. And Fuad, her husband, called me the day before the funeral and told me, Gabriel, what can we do? We want to raise some money for a research fund at the hospital. And I saw in this the opportunity for my dream that started with Jerry. Said, Fuad, listen, we have money for research, a lot of money going to research, but nothing goes into the patient's quality of life. And your wife was wealthy. She could afford having so many great things happening to her, helping her to die. So we should try to do something in her name so other people can benefit from what she was benefiting from. He loves the idea. So he made a flyer in his office, and the next day at the Mass, he gave it away, and we raised a lot of money at the church that day. And when I got that money, I was actually, a couple of years later, director at the hospital, and I wanted to start the Helen Sawaya Fund. So I meet the wonderful Joanne, who I had no idea about music therapy. I didn't know what it was. And I didn't know that we had a department of music therapy in our sister hospital, Beth Israel. And I meet Joanne, and I realized, oh my God, this is like unbelievable. So Joanne was the first person I worked with for that Helen Sawaya project. So I'm going to show you a little bit what the project eventually became. So of course, music therapy, as you see, right here, and I don't need to explain to you what music therapy is, obviously, in this crowd. Then we have art. We had artists, not art therapists, artists from New York who are paid by the fund, obviously. And then you can see their work. This is their cart, their shop, and then all the patients here. And actually, with the program, many times you have patients play some music, then do some art, and then vice versa. So all these programs blend together. We have an unbelievable massage therapist here. This patient, for example, young woman, 36-year-old, lovely, who was getting chemo and did not respond well to the nausea drugs we gave her. So Monica sat her down. In 10 minutes of feet massage, the nausea was gone. So simple things that make a lot of difference. We have pet therapy. We have the cute dogs who come with their badge from the hospital. This patient actually is a musician. Actually, she's conducting a choir. And she had a terminal pancreatic cancer when I met her. She now died, unfortunately. This was her first chemotherapy session. And she sat down, and we got the dog therapy that day. And she loves dogs. Her first chemo became fun. Within 5 minutes, she had this picture on Facebook sent to all her friends from the chemo suite. Again, simple things. This is Laura. Laura is a patient of mine with breast cancer, lived 7 years with stage 4 breast cancer. When I met them the first time, she came with a lot of disease, but she was not feeling bad. It was around Christmas time. So after the consultation and my recommendation of treatment, I recommended a pill, not chemotherapy, actually. Her husband came back to see me. He said, can you sign this paper for me because we want to cancel our cruise for Christmas? I said, why do you want to cancel the cruise? He said, she has cancer. She's on treatment. I said, no way, you're going to go. You planned for this, you're going to go, you're going to be fine. So it took me 15 minutes to convince him not to cancel the trip. So he believed me eventually. They returned after the cruise with a huge smile. They had such a great time. She had gained so much energy from that cruise. And then the next question they had for me, when can we go again? So I said, listen, you make your schedule for your cruises, and I will schedule the appointment or the chemo between your trips. So she lived 7 years from trip to trip. Every time, every trip would be another project for the next trip. So when Laura died, of course, Bill told me they were the best 7 years of our marriage. They had such an amazing time, those 7 years. So he wanted to do something. He knew about my program. So we created Laura's Journey, and we put a fund aside where we will offer trips to the patient. So every 2 to 3 months, we used to come to the unit, we give, papers they will register, and we will do a session of Lotto, basically. The music therapist will come, we'll sing a song all together to create some atmosphere, and then we will draw the winners. And every 3 months, there were a couple of patients who would travel on a cruise. Now, Bill had become an expert in cruises. He will tell you which is the best ship, which is the best month to travel, which is the best room to get. And he used to make all the booking for the patient right there. So this is the kind of stuff that you can do. Then came another patient of mine whose name is Agnes Faris, who actually was a very wealthy donor and a huge opera lover. Just to give you an idea, she gave $10 million to the Metropolitan Opera in New York. And she was in every philanthropy possible. So she was my patient. And when she was getting radiation to the brain tumor that she had, she saw all these women without hair, without makeup, and she's a leader woman, I would say. And she said to me, listen, I can't see this. We have to do something. So she had her personal beautician who actually did the makeup for the Metropolitan Opera artist. We made a deal with her, and her name is Lisette. So Lisette comes twice a week, and patients sign up. This is her business card. And they come and would have their makeup twice a week. And you have no idea how they feel when they look so beautiful and gorgeous. So, now, who is thinking that he is a caregiver in this room? I will see more hands. All right. Now, who thinks he's a healer? Guys, all of you are healers. What are you talking about? Now, how about being caregiver and healer? And I will tell you what I think. If you feel that you are, you have to believe it, not think it intellectually. You have to believe you are healers. Each one of you is a healer. And if you feel this way, I can tell you, you will become a better caregiver. But think healing first. That's the most important. So let me tell you about the state of mind of the cancer patient who were just diagnosed. And I'm sure what I will say is even less than what they feel that day, much less. So just think of a woman who wakes up in the morning, and after waking up, she realized that somebody raped her at night. And on top of it, she's pregnant, and she didn't even know it. She didn't realize, but now she understands she was raped. This is how they feel, the patient. They wake up one morning feeling normal, and they have a cough or a stomach pain, or they go for a plain routine mammogram or an x-ray. And now they are told, you have cancer. This is the same feeling. You've been raped without even witnessing the rape. You know, I think that people who are raped and can remember the events eventually might come to some closure. But here they don't even know that. They don't even know how it happened. So they start asking you, what did I do wrong? And they start to feel guilty about it, always. This is like the guilt you can presume in every patient is there. Even if they don't look like it, they feel guilty. What did I do to deserve this? So of course, a smoker will think smoking, etc., but most of the patients did nothing. Even the smokers, I don't blame them because they're the victim of the marketing of the cigarette. So overnight, you have a patient who has been shattered. They are now frightened. They wonder what tests they're going to have, what biopsy they're going to go, how they're going to be disfigured, what body part they're going to lose. Are they going to be able to see their grandchild graduating? Are they going to be able to, I don't know, attend the wedding of their daughter? Are they going to be able to pay the mortgage? I mean, everything that comes to their mind, and the brain is boiling of these fears. So this is the kind of patient you meet when you come for a music therapy session. So this is really a post-traumatic, stress disorder that they are living to the max. This is so intense. And now they are coming to see you. So I looked up an easy definition. I'm going to read it. So, post-traumatic stress syndrome is a mental health condition that's triggered by a terrifying event, either experiencing it, which is the patient, or witnessing it, which is us. We're witnessing this. They're telling you about it. Symptoms may include, so both the patient and the witness, all right? Symptoms may include flashbacks, nightmares, and severe anxiety, as well as uncontrollable thoughts about the event. Uncontrollable, all right? Remember that. And they can last forever. I mean, I have heard stories, thank God, not many, because we have very good drugs for nausea nowadays. But in the past, when I started to practice in the 80s, we didn't have such great drugs for nausea. Some patients, when they arrive on the street of the hospital, the day of the chemo, or even another day, or even years later, would start vomiting. Just because, I remember one day they sent me a patient from Romania for a second opinion because she had a sarcoma 30 years earlier. She was treated then, there was nothing for nausea at that time. And she started to vomit. They did a workup on her, and eventually they concluded that maybe she had cancer that they could not diagnose. So they referred her to me to see what's going on. So I spent a good hour just on the history. Listening, by the way, as you were mentioning earlier, is your best diagnostic tool, but you have to give time. I said 30 seconds, I was wrong. You said 12 seconds, I remember that study, 12 seconds. It's frightening to know this is true. But here it took me a good hour to get all the story from her. And I concluded, I said, this is post-traumatic syndrome. You are remembering. She had some stomach virus one day. It reminded her of cancer, and they could not stop the vomiting anymore. So once I made that diagnosis and I made her believe this is true, she got better. So this is how deep those trauma can go and can make surface again many years later. So what is the challenge for you guys? This is your patient, shattered. Shattered also by us. It's not only us, of course. I'm putting MD with the medical team, the doctors, the test. You know, once they have the diagnosis, they're going to go through the mill. CAT scan after CAT scan, biopsy, rebiopsy, porta-CAT. I mean, this is like, by the time they start the first treatment, they're running on empty. So that's how they are. And then you are asked, with your magic mind and hand and soul and brain, to start to repair this shattered, beautiful thing, all right? So you're not bad, you do it, all right? Of course, there are many scars, but you do it, okay? So what happens is that something about the truth. I'm going to tell you about the truth now. Very few doctors will give the full truth the first time, if ever. A number of doctors will hold some of the truth. Some will say nothing. Depend also of the culture. There are different cultures where they tell you, oh, in our country, you know, they can't handle the truth because they will be depressed, etc. And I can tell you, in New York, you have an international crowd. You have people from every place, in every culture, every continent, every country. And I have the chance to see them, of course. And they are all the same. No matter what people tell you, don't believe anybody who tells you, in our country, they don't do this, and in our culture, they don't. They will be happy with the truth. And I feel that when you say the truth at the beginning, it helps a lot patients to cope. But when you do the trickle truth, which I think is the worst, that's what you experience. The patient is told something on the first day, which is good, already bad news, but not the whole story, because we don't think they can handle. The next time, we give them another piece of it, and the third time, another piece. So every time, we're beating them up, and that's what happened with you. You fix the vase, they are feeling better, they come back to you, they got more news, so it happens again. You, again, are subjected to the trauma of their trauma, all right? So again, it happened again. And every time it's getting worse because now what happened in their mind is that they wonder, well, what is the next thing they're gonna tell me? They already told me twice something worse than the first time. And now every time they come to you as a doctor and you as a music therapist, they are just wondering, what else now I wanna hear? Well, if you really were honest the first time, you tell them the whole story, now they can start building on recovery rather than coming back and be again traumatized, again hit on their head. So why not trying to decrease or prevent this trauma? Why don't we try beforehand instead of patching it up, which is so much harder and less successful? So there are not many ways. This is a picture of my desk. You can see my business card, my latest Hippocrates. You know probably where this is coming from. My wife offered it to me many years ago. I love it. It's on my desk always. This is actually, who is from the Philippines? Who knows what this is? The Tree of Life, which a patient of mine offered me. And this is actually a mug that one of my students offered me after spending 2 months with me and then seeing the power of the truth and how it transforms the patient experience when you are honest with them from day one. And this is what you read on this. Can you read it? So when patients sit in my room, you think they look at the other stuff? They look at this first, and they have a big smile on their face. And I see it like a wife tells her husband, "Did you see what is on Dr. Sara's desk?" And they pull their phone and take a picture of the mug. And when we finish our consultation, they tell me, "Well, you were right." So they feel that I was honest with them. Because basically, these patients have zero control on anything. Anything. You know, I have to say, I've seen from homeless people to powerful head of states, rulers, who are ruling a country in the same office. They all have the same feeling of losing their control, and they are all equal. Don't think that because somebody is rich or powerful, he's going to react better. They are all the same. As a matter of fact, they want you to treat them the same. And by the way, a little tip for music therapists and any therapist, try to make sure you don't fall in the trap of the VIP syndrome. The VIP syndrome is somebody who's recommended to you, especially the friend of somebody, the husband of a doctor or the wife, or a very important congressman or some big businessman, and they expect you to treat them differently. And if you do, you're going to make mistakes. And any doctor in this room will agree with me that when we look at a patient as a VIP, we either over-treat them or under-treat them. So sometimes patients come to me, and at the end of the consult, the wife says to me, "Well, you're going to treat my husband especially because, you know, we are the friend of so-and-so." Well, I shock them always. I like to shock people. Say, "No way." And they feel like, I said, "You know what? Because if I answer to yes, you should leave my office. Because if I change my practice or my standard because somebody asked me to do so, then I'm a jerk. I'm not a good doctor. You should not trust me ever." And now they give me a big smile. I say, "I'm going to treat you like everybody else." And I have colleagues of mine who are my patient. And the first day I tell them, "Listen, this is going to work under one condition, that I'm going to treat you like I treat anybody else. And I would not even talk medicine with you. I will talk layman language with you. Because I want to be honest with myself and you, treat you like anybody else." And that's what patients want. Patients want to be treated like human beings, not doctors, president, whatever. They don't want it. When they're sick, they want to be able to be themselves, simple human. And that's what you need to always remember. So information is very important. The more you inform a patient and the more power you give him, that's the only thing they can't control is the information. Many times patients come and say, "I want my reports." So you give them all the reports and they don't understand it. But they walk around with an envelope full of reports feeling that this is power. But when you explain to them, this is true power, not just giving them the report. So I give them the reports if they want to, but I never give it before explaining to them everything and answering all their questions. And when you do that, when I have to drink some water, when you do that, actually, you're making them part of your team. You're telling them, we're working together. I'm not here and you are there and I run the show. We are on the same team. And if a team works together, everybody has to have the same information. So I tell them, whatever I have in my head, I will tell you exactly what I think. If I could be wrong, I could be wrong, but it will be what I think. And I'll speak my mind with you. Once you do that, they are feeling so much empowered and respected. So, as you see, team spirit, caring, reassurance, all of these things happen when you do this way. And a little thing I play with, you have to play with your patients sometimes, some games, and they like it. So, at the end of my conversation, what I tell them, once I feel that they're comfortable and they're now relaxed about the conversation, I try to make them realize how powerful they are. Because they arrive in your office in pieces. you want to try to build them up so they can fight. They're powerful. They feel that they can do something. So I say, listen, I want to show you how powerful you are. Can anybody argue with you today if you refuse to go out some night or you want something? Nobody's going to argue with you in the family. You say, I want this, they'll do it for you. I don't want this, nobody will argue with you. So you have to use this power. So I say, listen, take an Excel sheet. We're going to do 2 columns. So I draw one in my hand. I say column A is all what you love. Sorry for the typo. All what you love in column A, it's not you like, you have to love. And all what you don't love goes to column B. And you try to fill your life with column A stuff. And whatever is on B, don't even bother with it. So they look at each other and they start thinking, okay, this guy, column A. This guy, forget it, column B. So they start to really improve their quality of life with simple tricks. Now, we haven't done chemo, we've done surgery, we've done nothing. But I made them aware that they're not shattered. They're still the same people they were before they were told they have cancer. That's so, so important. So I'm going to show you a couple of clips, and I'm going to have some comments and maybe some feedback from you. Reversing the roles, the patient supporting his doctor. So this is a sternum and a needle. This is a bone marrow. Now, has anyone seen a bone marrow done ever in this room? Okay, see a couple of hands. So a bone marrow is basically anesthetizing the skin, then the bone, and then putting a needle in the bone and aspirating some blood. And if you do it from the iliac crest, which is right here, you can take a biopsy. This test frightens people. It has such a horrible reputation. Just the idea of bone marrow, people are already shivering. So when I need a bone marrow to be done in general, I don't tell them, next week come for bone marrow. I tell them the same day, we're going to do it right now. If I don't do it right now, they have 1, 2, or 3 weeks of nightmares every day till the test is done. So it's a very high, stressful test for patients. And the worst patients for this are the patients who have leukemia because they need many bone marrows. It's not one time. So that bone marrow experience has to be really good. Otherwise, every time they need one, they're going to die from this idea. So I happen to have a patient who's a singer, him and his wife. And I know from Mitch, our former music therapist, was a fantastic guy. He told me he has an amazing voice. He loves singing. He had many music therapy sessions with him. And acute leukemia patients are the people who get the harshest chemotherapy. The first chemotherapy is scheduled. They stay a month in the hospital. They get transfusion, they get infections, they get high fever, they get mucositis, they get diarrhea. This is 1 month of misery. The treatment for leukemia is way worse than the leukemia itself. So, but this is tough time for them. So he needed the bone marrow. So I walk into the room with a medical student, and this is to show you about the intuition of music sometimes, how it can come, and you should embrace it when it happens. So I walk in, and I see him like so frightened. You could feel in the room the fear all over. And I swear to God, without thinking, I said to him, "You're going to sing for me?" I said, "Yes, I heard you had a great voice. I need your help for the bone marrow." So I played the games that I need you so I can work well. So power. You gave him power, all right? And you gave him a chance to focus on something. So can we go for the video?
I think it'll get better once the pain starts dissipating, 'cause you're putting local in the spot. It will hurt less eventually. I think it'll get better soon. Hoping it will soon. And when
Did you hear Dr. Sara?
He was in tune in a nice way. I think this hurts less.
You're right.
And I'm sure.
Hallelujah.
Hallelujah.
How you doing?
I think I'm doing okay.
Alright, alright.
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 Yeah.
Hallelujah. It doesn't hurt that much. Here's hoping I continue.
Let's continue. He's open that continue.
This is a big deal for the bone marrow.
Continue.
We're on.
Continue. Continue.
Hallelujah.
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 Oh, continue. Oh, continue. Oh, I can feel you screwing something there. I don't want to see, but I can feel a little bit. I think this really does help. I think the
This really
singing
does help. I think this really
Hallelujah.
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 It might hurt now.
Oh, great. Thank you so much. Hallelujah. Oh,
Do you feel it?
a little bit,
Great.
but not much.
Alright.
I think it's
Very
better.
good. Great job.
Great job.
Actually, I didn't know it was being filmed. I had no idea. When I started to do it, my student, who was very smart, pulled his iPhone and filmed it. And when we left, he told me, I filmed it, Dr. Sara. I said, what? He said, I filmed the whole thing. So I saw it. I thought it was amazing, but I didn't realize it. I was really in it with him. But when I see, I am very moved myself. I've seen it 50 times maybe since then. But it was great because he had this idea to film it. So, but again, this is an example of intuition without thinking. I did it, and then you can see the music really took care of the bone marrow for this guy, and all these future marrow were never a problem for him because it was not a trauma. So we can prevent the trauma beforehand, and the music did it here. So, as we said, this PTSD, you actually live it every time with those patients. And you can eventually suffer from compassionate fatigue, going through all these moments when you have to witness it and witness it every time and do the best you can. Eventually, you are exhausted. And I heard that some talk today or tomorrow about the burnout of physicians, which I personally also did some work on that before. So how can we are the wounded healers. And we need to be healing people, and we're wounded. So it's not an easy job. So we have to see how we can also take care of ourselves. So that's why I have this breakfast on 9A, which basically is an idea I had maybe 10 years ago. One day, one of my fellows came to me, and this fellow was somebody who was very, very timid, low-key. He would never express his opinion. He was like very absent, but we should not think that people who are absent or silent are not having feelings. They maybe have so much feeling they are overpowered by their feeling, they don't open their mouths. So he catch me in the hallway, said, Dr. Sara, I am very upset. Wow. This is the first time he was talking to me about something. And I could feel he was so disturbed. I took him to a little room. I said, come, let's sit down, talk about it. So in 3 minutes, I figured out he was 30 years old. He had a 30-year-old patient with leukemia who was dying. The treatment didn't work, and nothing could be done. And he could not take it. He felt that he failed his patient. And he was his age, so it was much harder for him. So we had a good talk, a good session of counseling, how you cope with this, etc. And he felt much better. And I walked out from the hospital. I said, how I have been so blind. He's not the only one. Everyone is feeling this way, but people are not talking about it. So I thought of having a meeting once a month with the nurses, with the fellows, where we can just sit down and then one person or two or three will tell their emotions about the case. It could be a very difficult case or a beautiful case, but emotionally challenged. So we started doing this, and it's transformed the unit. You know, everybody was feeling so much better, coping so much better. And eventually, when we started to have the music, the musician came, the artist came, the social worker came. It became an incredible family reunion where people can express themselves freely. And I bought some breakfast stuff to make it more exciting in the morning. But then once we got the musician, they immediately pitched in, and they started to come at the beginning of the meeting and play music, very Zen type of music. So when people will come in the morning, they will enter the room, and there will be this soothing music. Already, people were just talking very softly, having their coffee. It was creating a loving atmosphere. And then we start, and I would say always, well, anybody has something to share. And always there is somebody who has something to share. We hear the story, and we start commenting on how we feel about it, how we cope with these feelings that we have. So at the end of the session, you know, these sessions can be very heavy sometimes. So the musician pitch again. So, yes, I'm sorry about that, but I mean the music therapists who are musicians. So our music therapists pitch in, and I'm going to show you a little session where the nurses are singing and the doctors, and you see the atmosphere there is, thanks to the music therapist. Can we have the next one? If I I'd hammer in the morning, I'd hammer in the evening, all over this land. I'd hammer out danger, I'd hammer out war, I'd hammer out love between my brother and my sister, all over this land. you see the release after the tension of that hour, how they feel. And it creates an incredible atmosphere on the floor, and it can last for a while. But there are days where it's different, obviously. So this is Marianne's story. Marianne was a patient of mine who was on the floor dying of cancer, and we expected her to die really actually even before the breakfast day that day, but she was still in coma and didn't die. And she was an amazing woman that everybody loved. She had sessions with a music therapist while getting massage with our wonderful Monica that you've seen earlier. The artist was there, and Marianne was stuck in the hospital for a month. She couldn't go home, and she was gonna die at the hospital. She loved her dog, and dogs are not allowed in the hospital. So our artist asked her, show me a picture of your dog. She drew a picture of her dog, made a big painting, put her in a room. But then one day I thought that, she's gonna die. We should get her dog to come and say goodbye to her. It was illegal. So I kind of pushed everybody to become illegal on the floor, including the head nurse. And we decided to bring Enzo the dog, hiding him, bring him to the hospital to see her. So we prepared. We waited for a weekend, not much surveillance. And then, I was directing the whole operation. And then I get a text message from the artist. Enzo, operation accomplished. So that's how much people love this Marianne. And it's not insignificant to know that. So I went away for one week of vacation while she was sick. And I returned. I had told Marianne she was dying. Like I say to all my patients, she knew she was dying. She was peaceful with it. She was accepting it. Her daughter, who worked for a friend of mine, was at peace with it. So I didn't expect any surprise. And when I returned, her daughter comes and tells me how one of our fellows, who was a nice guy, but just didn't know what to say, spoke to her about death in such a harsh way that he disturbed her so much. While she knew she was dying. And the whole family was horrified. And I was really upset, so I called the fellow and counseled him on how to talk to patients. But then at the breakfast, what surprised me, that who has something to share? And one of the nurses started to tell me how upset they were when they heard the story. I didn't know that the nurses knew about it. And all the nurses knew about it, and all were upset. Some even cried. Again, this is the trauma you get when you see your patient traumatized. They cried in that breakfast. So Marianne was supposed to die the day before. She didn't. She was still alive that morning, but really at the end. And at the end of the session, Mitch sings Imagine. Imagine was very, very emotional. And already the emotion was very high. So when we finished the song, the massage therapist says, guys, how about if we go and sing Imagine for Marianne? Wow. You see, another moment where music comes unexpectedly, and you have to embrace it. I said, of course, let's go. So we went to the bedside, all the nurses from the floor, the music therapist, myself, and I was hoping that her daughter will be there to live this moment with us, and she wasn't. So let's hear the next video. So we started to sing at the bedside. I said, Patricia has to see this about her mother. So I pulled my phone, and I filmed Imagine at the bedside of a dying patient. Go ahead.
There's no country, it isn't hard to do. Nothing to kill or die for, and no religion too. Imagine all the people living life in peace. One last chorus. You may say I'm a dreamer, but I'm not the
died 2 hours after this song. So, but that was very powerful, I can tell you. So let's talk business, bottom line, which I don't like this word at all. But we have constantly the hospital people talk about the bottom line. This is their obsession. It became more important than the patient, I think, and us and the care, and we are only worsening. There's no way, we're not getting any better. So when they hear about the music, they make this kind of comment. This is a nice distraction for our patient, We look good for the marketplace because we have music, Thank you, thanks to philanthropy, because they don't pay for it, but the philanthropy pays for it. And I think we should stand up for the music therapy. We should stand up strong. We should show them that they're making money because of us. I mean, I'm saying us, I'm not a music therapist, but I feel I'm part of you a little bit. So allow me. Allow me to have upgraded myself to your level, guys. But we should say, you are making money because of us. And we should show them these things. So I was listening to your wonderful presentation yesterday with all the data you were showing, which are amazing. But these people don't care about this data because they are scientific data for us, but it doesn't put money in their pockets, so it doesn't matter. That's what I see. I see at the ASCO meeting like 2 weeks ago, where one drug that I prescribed for cancer patient is $30,000 a month sometimes. So you imagine the drug company who are sponsoring all these meetings with millions of dollars, and who's sponsoring us today? Where are the millions of dollars? Because they don't think that there's money for them. So we should make the hospital administration realize they're making money because of you guys. And we have to prove it and show them numbers in dollars, not only scientific, because they don't care about the data scientifically. They really don't. Let's not kid ourselves about it. So we should tell them, no, sir, music is not a distraction. It's part of treating your patients. Would you like to come and watch a live session? We should invite them. Let them see it. And believe me, when they see it, they open their eyes. None of these guys are stupid. They are smart people. They have a good heart, but they are stuck into making money. So you have to believe that in the worst administrator, you can wake up an angel if he touches something magic. And you can do that. I try to look at every one of these guys as a potential great guy. If I look at them this way, I talk to them this way. If I say it's another jerk, I'm going to talk and make him feel they are jerk. They will never say yes to me. But I have to talk to their part that they can potentially be wonderful people, and then you can bring them in. And we have to do that. Invite them to your session. Let them watch it. Let them see it and taste it. So there are many studies happening, but there is one that I want to share with you where Joanne is leading, and which is a study in the ICU. One of our patients died in the ICU, and she was a leukemic patient and had been married to her husband for 58 years, had children, grandchildren, an amazing woman who actually sings well and had a beautiful voice. She had a few sessions of music therapy before she went to the ICU. And the music therapist got her wedding song, 58 years older, found it on the internet, and learned it and sang it for her. She was so touched. So when she was in the ICU, comatose, her family was there. They knew she was dying. They were there to support her dying. They were preparing themselves and ready. So Mitch came, and he sang that song for her while she was dying. So her husband was holding her hand. When they started to sing, she started to hold it stronger while she was comatose. The whole family was here with the grandchildren. It was a beautiful death, not a traumatizing death. So the ICU team showed that. They were really impressed by the music therapy. So the director came to me one day, said, listen, we would like to see what we can do for our patients. And as you may or may not know, in the ICU, the patients who are intubated are a big challenge because you need to remove that tube so they can get out of the ICU. They want to make this turnover as fast as they can, and it's good for the patient. So when you extubate somebody, you can succeed to do it if they are physically doing well and emotionally capable to handle the anxiety of having the tube out. So that part we can work on. So she was thinking maybe the music can help. The music therapy can help this. So we spoke with Joanne, and we got all excited. We got some money for it. And we're going to do a study. We're going to randomize patients for extubation who are similar cases to see whether we can gain a half day a half day in the ICU is many $1,000s. And we hope that with this, we can go to our bottom line friends and show them the bottom line, that you made money because of music therapy. And we should try to think about projects that we can show them numbers. Nothing works but money today. Let's have no illusion. What we do, we have to do some dollar amount, and then hopefully we can get somewhere. I used to think that I could tell those people some nice sentence like this one from Einstein, which is beautiful. Not everything that can be counted counts. Not everything that counts can be counted. So naively, I would think that this will convince the bottom line people. It doesn't matter. This is beautiful. It's like they say, so music is beautiful. They want numbers. We should give them numbers. So the last couple of minutes here. So in medicine, in oncology, we have names for every chemotherapy combination. ABVD, CHOP, whatever. So there's one that is called TC, Taxol and Carbo. But we decided to change it one day to Taxol and Carbo to Tango and chemotherapy. So the artist that works in our service actually takes lessons of Tango. And we had an amazing therapist called Yoshi from Japan. But he's totally Argentinian in his soul, completely. You see him, he's Japanese, but he is Argentinian. He worked there. He plays tango like a god. So he was playing tango for the patients. And then Nikki, our artist, said, why don't we dance tango for the patients? So she came to me and said, Doctor, I have a crazy project. You are the only crazy guy here who can accept something. And I love the idea. So we created tango and chemotherapy. All right, so I'm going to show you a couple of pictures. So here, this is Yoshi, and I don't know the name of this lady who was visiting with him. Now, there is a lady sitting here thinking, to make you think she's a patient, and does anyone recognize who she is? That's Joanne, all right? She was there that day, and she was with us during the therapy. So look at the faces of the people all over. This is Yoshi and the team here. I mean, it was really fantastic. Look at this view of the chemo suite. The patients here, they are dancing in the middle. These are the nurses who are having such a wonderful time. So can we see this video? So I apologize, I went over time. I didn't control what I said, but I hope you'll forgive me. I started traumatizing you with the bombing, and I hope that by now you healed from that bombing with the power of the music. Thank you very much, everybody. Thank you, Joanne, for inviting me.
Thank you, Dr. Sara. So again, to stay on schedule, we have no time for questions. Talk to him later.